Good evening and welcome to our COVID-19 update. I'm Ladi Akiridoluale here are the highlights at this hour. Federal government says Nigerians started to relax before case numbers reached their peak. Calls for more vigilance and compliance to COVID-19 safety protocols. Plateau authorities explain rise in positive cases of COVID-19 as being the result of more tests conducted. INEC to conduct by-elections in the state according to COVID-19 protocols. And European countries tighten COVID-19 compliance protocols as French President Emmanuel Macron says a second lockdown cannot be ruled out in France. The Minister of State for Health, Dr. Olorunimbe Mamora, believes that the PTF efforts towards reducing the spread of COVID-19 are paying off in spite of the number of cases being reported daily. The minister, who spoke to journalists shortly after commissioning a new accident and emergency building at the Federal Medical Center in Ebutimeta, Lagos, says increased advocacy and enforcement on compliance with protective measures will further flatten the curve.
I know that even as at the time we started relaxing the measures, we were yet to peak. But I must say that to a large extent, we see some level of compliance in terms of non-pharmaceutical interventions and advisories which the PTF put in place. But besides that, I want to believe that people are beginning to also appreciate what we talk about because we engage in a lot of advocacy. And we continue to tell our people that as individuals, the primary responsibility for your health lies with you. So it's in your own interest to protect your health because that is the greatest asset available to you. It is not all the time. In fact, there is no way government can fund everything. And that's why we built partnership. Government has a duty to build partnership with the private sector, with well-meaning people, with groups. What is at the common denominator is the good of the people.
In the last 3 days, Plateau State has been leading in figures of positive cases as reported by the Nigeria Center for Disease Control, NCDC, a situation which has been attributed to more tests on citizens within its territory. With this increase, the Presidential Task Force on COVID-19 says the epicenter of the pandemic has gradually shifted to that state, having earlier been in Lagos and Kano, Ogun, as well as Oyo State.
With more than 2,000 cases, Plateau State's number is on the rise. It now stands as the third highest test cases in the country, behind just Lagos and the Federal Capital Territory. Permanent Secretary in the State Ministry of Health attributes the high number of cases to the increase in the number of tests conducted among citizens in the state, which commenced with the state civil service as workers must now have a compulsory test to ascertain their status.
So far, 25,592 people have been tested in Plateau State. That is the third highest in the country. So you can see that Plateau State is testing aggressively. And out of this number, we have received cumulative results of 23,064. That is to say we have pending results of 2,525.
However, observation of protocol guidelines has been a major challenge in Plateau State. Although some favor wearing of face masks and hand washing, majority do not comply with the directives.
Wearing of face masks has dropped. Places where they had hand washing facilities, if you inspect a lot of them, you find out that there's no water in those buckets, or there was water, there's no soap, so there are a lot of issues. Then physical distancing is not there. Avoidance of social gatherings. There are weddings, funerals, church services that are going on without observing the current protocols. So the implications, of course, are that, the direct result is just that we're going to have more infections. More infections means the likelihood of more deaths. More infections mean the likelihood of more people being on admission, maybe with moderate to severe forms.
As the state government extend the tests to the local government and the rural areas, it says citizens should avail themselves for testing in order to ascertain their status, while advising that they should also adhere to safety guidelines to prevent community spread of the coronavirus.
Meanwhile, the Independent National Electoral Commission, INEC, says it will conduct a credible, fair and acceptable election as the people of Plateau South Senatorial District go to the polls for the by-elections scheduled for October the 31st. Addressing stakeholders at the INEC office in Jos, the state capital, its resident electoral commissioner, Halilu Pai, says the electoral body will adopt technology and innovations that will ensure transparency and fairness, as well as enforce precautions in line with safety guidelines for COVID-19 during the exercise.
The Independent National Electoral Commission, INEC, says all is now set for the by-election into the vacant Plateau South senatorial seat. This is after the Commission had a meeting with political parties, civil society organizations and security agencies in an interactive session to discuss the election's schedule and INEC's preparedness. 13 political parties will take part in the by-election, which will hold in 6 local government areas with 671,209 registered voters across 68 registered areas and 712 polling units to elect the senator that will replace late Senator Ignatius Longjan, who died in February this year.
INEC has brought about another initiative to ensure and to give confidence to our stakeholders that we are transparent and that whatever we do as neutral umpires, we are open.
It's very necessary because we have a constitutional obligation as an essential service provider to conduct elections.
To comply with the new normal brought by the COVID-19 pandemic, INEC says it will conduct the elections in accordance with all safety protocols.
In line with these constitutional provisions, we, in carrying out our duties, should not be seen as agents of distributing the virus to others. From the foregoing, elections during this period will be conducted with strict observance of the COVID-19 protocols.
The process for the by-elections into the Plateau State South Senatorial District has commenced, with political parties scheduled to conduct their primaries in the first week of September 2020 and to commence campaigns which will come to an end with 48 days to the election date. The elections will hold in Shendam, Kwangpang, Mikang, Langtang North, Langtang South and Wase local government areas.
The Minister of Humanitarian Affairs and Disaster Management, Sadiya Farouk, is appealing to the Gombe State government to take precautionary measures against flooding arising from heavy rainfall, which may further compound the negative effect of the COVID-19 pandemic on citizens. The annual flood outlook shows that 102 local government areas in 28 states fall within the high probable risk areas. The minister made the appeal after a visit to Governor Inua Yaya, announced the release of food items from the National Grains Reserve for onward release to those affected by the flood, as well as COVID-19 in Gombe State.
The impact of the 2020 rainy season has resulted in flooding and in some cases loss of lives and properties. Just as other states, Gombe State is not left out, as flooding has affected the livelihood of many. How to mitigate the impact of flooding on one hand and that of the COVID-19 pandemic on the other is one of the reasons why the Minister of Humanitarian Affairs is meeting with the Governor of Gombe State to find ways of adhering to rainfall predictions. She explains how the federal government is providing relief materials to support persons affected.
although climate change has been largely blamed for this increasing phenomenon, it is our collective responsibility as government and people to evolve strategies to minimize losses through adherence to warning alerts, early preparation, and proper and prompt response.
The effect of flood.
The governor of the state expresses gratitude for the intervention. He is hopeful that it will bring succor to those affected by flooding and the COVID-19 pandemic.
80% of the people are farmers that are engaged in either livestock or crop production. And as such, with the effect of flood and gully erosion and desertification, their means of livelihood really just out of control, and they fall into the capacity that is always very vulnerable for any severe economic hardship that may impact the people.
The minister then leads the governor to receive the items. About 1,470 metric tons of millet, sorghum and maize were handed over to the governor for onward distribution to those affected.
Okay, let's take a look at this point at where we are with the COVID-19 situation, seeing its effects in various parts of the country. We're talking to the National Coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu. Dr. Aliyu joins us via Skype from Abuja. Good evening, Dr. Aliyu. Thank you for your time this evening.
Good evening. Nice to be with you this evening.
Let's begin with where we are now. If you took a listen with the report from Plateau State earlier in the program, there is the continuous story, as we have heard from other parts of the country, that we seem to have relaxed too soon before we got to the peak. What can you tell us about that?
So just a note of caution, really. The number of cases that states report is directly linked to the number of tests they do. And we know even at the current stage where we're at, for every positive case we get, we're still missing a fair number of cases. So if you look at Plateau, for instance, it's a direct result of the increased testing, which is an excellent thing because you need to know where your problems are. We have about 20 local governments at the moment, which we have designated as hotspots. They are responsible for more than 50% of the infections we currently have. But we also have states that we call silent states, where they're not even testing at all. And our suspicion is that there's a lot of COVID-19 infections going on in those states. And if we were to test for states that are not testing, my argument with them is if you test and you test a lot and you don't get any cases, then that's fine, you can open up. But if you do not test and you are one of the silent states, you will never know the extent of your problem. While Plateau is doing the right thing, we shouldn't really look at Plateau as a sort of, there's no shame in having a COVID issue in your state. It means that at least you know what to do to deal with it. So Plateau is doing the right thing, Lagos is doing the right thing, FCT is doing the right thing, and a few other states like Kaduna, for instance. But we are still very far from our testing targets. Our testing targets are, ideally every state should test at least 1% of its population. Lagos is at around 0.5% of its population in terms of the number of tests together with FCT. And the Plateau is coming up really nicely. Yeah.
Let me take you to the issue of the national response. I'm happy you mentioned the states there and this whole issue of testing and the fact that the response has been uneven. Some are doing much better than others. There are those who have asked for a national drive for sample collection and testing driven by the federal government or indeed by the PTF. What they refer to is that a big push to get people to come out for testing, now especially that the capacity is there.
Absolutely true. So if you look at the number of laboratories, we've expanded from just a few laboratories in March to 64 laboratories so far. But the majority of these labs are underutilized. At the moment, we are testing at around 3,500 tests a day. We have a capacity for more than 10,000 tests a day. It's become almost like a fashion. Every state wants its molecular lab. Well, my challenge to the states is, now that we've given you a molecular lab, get on and find out where the issues are. Let us test. Let us encourage people to come out. If they're having symptoms, let's encourage people who are at risk. Let's encourage the vulnerable in particular to make sure that people know the importance of testing, particularly when you start having respiratory symptoms or symptoms consistent with COVID. And for those that have been in contact with with cases, for instance, the close contacts, is particularly important. We will never know the extent of the COVID problem in the country unless we test. Testing is really the gateway into accessing treatment as well. We're very pleased, as I said, with some states. We have now started giving money. That's the RADISI grant. Virtually every state in the country has had 100 million naira in the last 1-2 weeks. We have an additional 1 billion going to 32 states in the next few days, hopefully. And this money is supposed to be used for COVID. We have set in place a motion to open up sample collection centers in local governments, particularly in the facilities that are high throughput facilities. And we are also setting up PCR laboratories, as the Honorable Minister of Health said, the gene expert machines in hospitals, major hospitals, so that patients do not need to go far in order to have a COVID-19 test. But we must remember, the 53,000 cases we have in the country is an underestimate of the true burden of COVID-19 in the country. It's a gross underestimate, because really, I'm very certain that the numbers, if we were to test widely, will be significantly more than that. And it's only by knowing people's status and their infectivity, that's the only way we can take out those that are infectious and stop further transmission from happening. But we have not peaked. We may be heading for a peak, but we have not peaked.
We haven't peaked. That was where I was going to go. The Minister of State was in Lagos earlier today, and he did repeat that statement, which I know you had made earlier, which is that we haven't peaked because we do not know, we do not yet know how much this burden is. That is what brings about the question of the increased testing. But the other issue is that even though we haven't peaked and we need to increase the testing, we are relaxing the restrictions. Just today, Europe is tightening back its restrictions, and France is saying there might even be the need for a second lockdown. But in our own case, we're easing the restrictions. Do you think there's a kind of paradox in this? On one hand, not knowing how much of a problem we have, but on the other hand, allowing people to go about their daily lives?
So there's no doubt this thing has been going on for a while. We've been doing this job for the last 6 months, and it's not surprising that people are fatigued. It's not surprising because for most pandemics, usually they don't last this long. The Ebola pandemic didn't really last as long as this one. Maybe the flu pandemic of several years ago. But the key thing is the public needs to understand the virus does not get tired. We might get tired, we might let our guard down, but the virus doesn't really get tired. It's there, it's waiting to infect the next person. I think eventually what will happen is we will plateau. Most of the modeling that we've had from our scientific and technical advisory teams back in March, April, suggested that the country will probably peak around late August, early September. But we need to be convinced that that is the case by increasing our testing. Now, going back to your question about where is the balance, it's a balance between lives and livelihoods. At this point in time, we cannot impose new restrictions without the evidence that things are going the wrong way. So at this point in time, we intend to continue the measures we are doing, but the public also need to remember, if all of us use the interventions that we said, the use of face masks, physical distancing, washing our hands, this thing will be over in the next 4 to 6 weeks. If consistently all of us apply these measures, it will be over in the next 6 weeks. But if we continue to not to comply, this will drag on and on. We've had this for about 6 months for something that we could have done something about it much, much earlier on by making sure that we protect ourselves. So appeal to the public is when we ask you to wear a mask. Remember, we want to reduce the transmission, and by reducing the transmission and getting on top of this, the faster we will return to normal and everybody can go back to his or her business. schools can open, airports can open, and we can all forget about COVID. But if we continue not to comply and continue to encourage transmission by what the chairman of the PTF says, romancing the virus, then this thing is going to be with us for months to come. And it's not going to help anybody at all, and neither will it help the economy of the country.
Indeed, that is a very strong point to make, Dr. Sani Aliu, and that is a point that has been made for much of the last 6 months. Let us thank you for your time on the program this evening and to wish you the very best of luck as you continue the national fight against this pandemic.
Thank you.
We'll take a break, and when we return, we'll talk to a number of other medical experts about where we are with this COVID-19 pandemic. Please stay on with us. Welcome back from that break. This is the COVID-19 update. Within the last 24 hours, the Nigeria Center for Disease Control, the NCDC, confirmed a total number of 296 new cases of COVID-19 infections in the country. Till date, a total of 53,317 cases have been confirmed, with 40,726 recoveries and 1,011 deaths recorded in 36 states and the Federal Capital Territory. The new cases are reported from 16 states and the FCT, with Plateau taking the lead yet again with 85 cases, followed by Enugu 46, Oyo 31, Lagos 21, Rivers 20, FCT 15, Kaduna 13, Bauchi 12, Delta and Ekiti 11, Akwa Ibom 7, Ebonyi 6, Kwara 5, Ogun and Osun 4, Gombe 3, and Niger 2. The Federal Capital Territory tops the list of 5 states with a high number of active cases, with 3,572, followed by Lagos with 2,627. Oyo State has 1,136 COVID-19 patients being managed, and Plateau has 1,065, while Edo has 186. Let's talk to public health expert now, Dr. Omede Ogu, who joins us from our Abuja studios. Dr. Ogu, thank you so much for your time this evening. Welcome to the program.
Thank you, Ladi.
I just heard now from, and I don't know if you heard from Dr. Sani Aliu, who was with us just before the break, that if we had complied with the prevention and management protocols of COVID-19, the masks, the social distancing, and so on, this whole crisis could have been over in 4 to 6 weeks.
Okay.
My question is, why are we not?
Well, thinking of, okay, go on.
My question is, why did we not? Because now it's been 6 months instead of 4 to 6 weeks.
Yes, we have appeared on this program again and again with different people bringing suggestions and experience to bear. We, as a country, I think the country has done a lot from the very first case of COVID-19 and effort that has been put in along the line of globally accepted, adopted response strategy for COVID-19, which is in 3 categories. At the highest top, you have control. At the middle, you have non-pharmaceutical intervention. And then at the bottom, you have the pharmaceutical intervention. Top on the list of control is early detection. And that has to do with testing. And you've listened to Dr. Sani Bello talk about testing. The basic reason why Plateau State is ranking 3rd highest in the country now is because of the increased commitment to testing. And that speaks a lot. So the question is, how many states are not doing as much as expected? In the context of public health balance, we said for outbreak like this, 10% is the tipping point. We need to do more. We need to do more. We need to do more.
How do we
particularly
go
in the
about,
area of testing.
Sorry to jump in.
And then in the area of contact tracing.
Sorry, my apologies for jumping in, but you said we need to do more. Obviously, there have been attempts to do more, but they foundered on many fronts. Why are we unable? Because now we have the capacity. We have the capacity to test a lot more people nationwide. 64 molecular laboratories. Some states have 2, 3 of them. So why are we not doing more testing?
Yes. Well, I won't say it's the seriousness we bring to bear in the area of control. Let's create a scenario here. We need to move beyond just intervention to a campaign level. Imagine when there is a national, call for national political campaign. What happens? Every word is reached with messages either from the community or the mass media, or even one interpersonal visit. We need to adopt the strategy of campaign because of the need to drive close to the 10% tipping point. We need to move from conventional intervention to combining campaign and routine approaches. For example, if you look at the health-seeking behavior of Nigerians, more patronize the private. What is the role of the private sector in the overall control in COVID-19? Conventionally, people are used to seeking care more in the formal and informal private sector. Now, in the control for COVID-19, our drive is more towards the public sector. What strategy can we put in place to bring the private in, where people go to seek care more, where people are traditionally used to seeking care, then so that the effort can be scaled up? I kept saying on this program that there is a need for overall national review. The strategies that have been put forward, which seems to be working, but which also has demonstrated a lot of delays and coverage inadequacies. How can we strengthen those strategies that exist? There's no reinventing the wheel. Globally, the strategies that have been put in place, I'm repeating again, are basically 3. Top on the list is control. Under control, you have early detection. Following that very closely is what we call contact tracing. If you look at investment in all of these category areas globally, you will see that the investment for any specific country that have increased interest for, ramping up the management of COVID-19, investment on testing or early detection is highest. Close to that is contact tracing. How many times in our messages do we talk about contact tracing? How many people even know what contact tracing is? In other climes that have made significant, overwhelming progress, what they have done about contact tracing, in fact, their investment on contact tracing is in the ratio of 1:1 for early detection. I will say again, there will be need for overall review.
Well, if we're going to do
the agencies
if we're going to do this
level,
if we're going to do this review, if we're going to do this review, I want you to talk specifically, because this has been 6 months now, and obviously the results have been patchy across the country. Some have done well in testing, some have done well in enforcement, others have done well in other places in terms of palliatives and so on. but there has been no national drive for any particular thing, either sample collection or testing. As you pointed out, is important for us, messaging and so on. There hasn't really been that national push. So I want you to talk specifically about what we need to do along those lines.
Yes, if you're at the national level, the measures at the national is a mirror image of the measures at the state and then at the local government level. At the national level, mostly what the national level is burdened with is development of protocols, policies, strategies, approaches that will help the state in rolling out, getting to people at the household level. So in my opinion, the PTF, the NCDC, and any other regulatory agency or organization at the national level will need to look at what their traditional roles in terms of curtailing diseases of epidemic status are vis-a-vis what have been done so far. At the policy level, do we even have a national plan for COVID-19 that is made public? If the answer is yes, what are the various indicators that are attached to this plan? If the indicators are there, what progress have we made at the national level with these indicators? We know indicators are measurable. What progress have we made? If the speed at the national level seems to be dragging back, what is done in terms of public health approach is look again at your review mechanisms of those of the plan you have put in place and the indicators that go with this plan. Are they really moving? Are they working? If they're not working, what lessons can we learn from countries that it seems to be working at the national level? Do we even need to build capacity at the national level by doing a study visit to some countries that have made progress and then transporting or transmitting those lessons we have learned to the national level and see how we can gain speed? So these are some of the
at that point, It's at that point, Dr. Ogu, that we're going to have to leave it. I did want you to land, and I think you have. Public health expert Dr. Omede Ogu was in our Abuja studios. Thank you for your time this evening.
Thank you very much, Laji. Thank you very much.
From our Abuja studios, let's go to Jos, the Plateau State capital, where we're joined by medical laboratory scientist Dr. Solomon Cholum. Dr. Cholum, thank you for your time. Good evening and welcome to the program. Dr. Cholum, are you with us?
I'm with you. Can you hear me?
Yes, I can hear you now. Let me launch straight into it. The issue of testing, you're a medical laboratory scientist. What can we do in terms of a national drive to ensure that people are tested? One of the things why people say they don't come out for tests is that the results take so long to come back, and that if indeed something is wrong, it may be too late.
All right, thank you very much for that question. For us to, close this gap, there is to expand our testing sites. The national strategy came up with first and foremost use the molecular laboratories that were available. Now, those have been used. Secondly, was use the HIV laboratory platforms, and those ones also have been integrated in the system. Now, we went down to activate or to repurpose the laboratories, and not all of those have been fully. So by the time that we're able to, explore and activate all the gene laboratories that are scattered around the general hospitals in this country, somehow the burden on these few laboratories that we have is going to be lessened, and that is going to have a telling effect on the turnaround time of the results that people are complaining of the delays. The delays are basically as a result of work overload that is burdened on the few laboratories that are now available. We may want to say we have scaled up from 4 to over 60, but what is that number with regards to a population of over 200 million people? So that obviously we have a lot in terms of expanding our testing site.
All right, then, Dr. Solomon Cholum, because of the slight audio challenge we're having with your Skype connection, we're going to have to end it right there. Dr. Cholum is a medical laboratory scientist, and he joined us via Skype from Jos, the Plateau State capital. Let's go outside our shores, where European countries and cities are tightening their coronavirus rules. In France, a new rule requiring everyone in Paris to wear face masks in public came into force today. Germans have been told not to travel to high-risk countries or regions. And in Spain, children as young as 6 have been asked to wear masks in schools. Meanwhile, French President Emmanuel Macron has warned that a second nationwide lockdown cannot be ruled out in the country if COVID-19 infections spiral out of control. Mr. Macron says his government is doing everything possible to avoid the countrywide imposition of COVID-19 restrictions. Here's more of this and other developments on our COVID-19 Global Update.
Residents in Paris on Friday did not show any reluctance to abide by a new rule making the wearing of masks compulsory in the city as the French authorities seek to curb a surge in coronavirus infections. Until now, wearing masks was mostly required in crowded outdoor areas in the French capital. Britain's government is urging people to return to offices and other workplaces where it is safe to do so to help the economy recover from the COVID-19 pandemic. Local media reports that Prime Minister Boris Johnson is expected to launch a campaign extolling the virtues of returning to the office and providing reassurance that it is a safe place, while a new online tool will help people avoid the most crowded trains and buses. Large mosques in Egypt have held Friday prayers for the first time since they were suspended in March. Worshippers followed precautionary measures, including wearing of face masks, maintaining physical distancing, and bringing their own disinfected prayer mats. The sermons themselves were limited to a maximum of 10 minutes. Finally, the U.S. has bought 150 million rapid coronavirus tests as part of a $750 million deal with Abbott Laboratories. Earlier this week, the country's Food and Drug Administration granted emergency approval for the firm's rapid test, which the company says cost $5 and gives results in 15 minutes.
We've got one more story on the home front before we go. Edo State has added a new COVID-19 testing center to its list of testing facilities, and that brings the number to 4 located in Benin City. The facility is a private one and is being referred to as the first private molecular lab in the South-South region. While commissioning it in the state capital, Governor Godwin Obaseki says he believes that government should create adequate space for the private sector to participate in healthcare delivery, adding that his plans are on to make Edo State the healthcare hub of the country.
This hospital today is quite, that's being commissioned is quite different. Apart from it being a day clinic, it tells us that there must be business. There's demand for medical services. That's why this group of very entrepreneurial doctors are taking the risk, putting their money upfront to put the investments to provide medical services to our people in Edo State. But beyond the regular medical services, they have on their own invested in a molecular laboratory, a PCR laboratory that has the capacity to also test for COVID-19. With this PCR laboratory, Edo State now has 4 testing facilities. Benin City alone has 3. And this one is unique because it's the first privately owned PCR testing laboratory in the south-south of this country.
That's our COVID-19 update package for tonight and indeed for this week. Remember, taking responsibility is the first step towards combating the COVID-19 pandemic. For more on the real numbers of the Nigerian situation, the situation on the continent and indeed in the world, please go to our website, channelstv.com. There you get an update on all the stories and all the numbers in real time. You can also get details of the stories indeed in other climes and on other issues, politics, business, and sports. I'm Ladi Akeredoluale. Do have yourselves a wonderful weekend ahead and do stay safe. Good night.